And fast brief. Good afternoon, everyone, and thank you for attending this COVID-19 press briefing. As we start, we'd like to extend our appreciation to all of you for your continued collaboration and cooperation with the government in our response to COVID-19 pandemic. As we've stated before, this is a fight that should not be left to government alone, but a fight that should adopt a whole-of-society approach. And this success that we'd get is dependent on the active participation of each and every one of us. And this is critical, particularly now because our COVID-19 positive cases have surpassed the 5,000 mark. And of course, we're all aware that this is through established community transmission. And this number is bound to rise and will continue to rise, and therefore we need to continue taking our role in terms of adhering to containment measures, ensuring that we do not overburden our healthcare facilities and that we are able to flatten the curve. And as a Ministry of Health, we've adopted a community-based approach. We've reiterated this in the past few days, that this approach is being handled together with county governments, and it's central to our response to coronavirus. It will center on community health, and particularly with regards to COVID-19 related measures. And as a strategy, it's important to note that this community health-based approach has been globally recognized to be an effective pathway with regards to improving healthcare delivery, touching on all diseases, all burdens of diseases, and contributing to health and socioeconomic development. And it is also important to note that this approach forms a key pillar of the primary healthcare approach, an approach that Kenya has adopted together with numerous other countries, as was committed in the Alma Ata Declaration about 42 years ago, and further reaffirmed in 2018 in Kazakhstan. As a Ministry of Health, we do have strategic plans that are guiding this community-based approach. We currently are implementing the second strategic period approach, 2014 to 2019, and this plan, as reiterated, really looks at strengthening community structures, ensuring that systems are effective for implementing community health actions, and that there's also strengthening of data demand and information for use at all levels. We are looking forward at the end of this financial year to begin a new strategic plan again that will look to further enhance these measures when it comes to community health strategy, and ensuring that we are able to utilize this great resource in terms of COVID-19. Currently, we are at 60 level of implementation in terms of community health in the country, and we expect to continue beefing up. And this forms part of the UHC agenda with the aim of ensuring that we have an additional community health volunteers onboarded in all the 47 counties. With regards to our COVID-19 situation, we currently have 278 people who have tested positive out of 4,074 samples which were run in the last 24 hours. This now brings our total tally of positive cases in the country to 5,811. And a cumulative number of cases conducted so far, 162,478 tests. Out of today's cases, all except 2 are Kenyans, and according to gender, we have 181 of them being male and 97 of them female. The youngest is 1-year-old infant, whereas the oldest is 84. And the cases are distributed as follows in terms of county disaggregation. Nairobi leads with 171 cases, Mombasa has 37, Nakuru 17, Kiambu 12, Busia 10, Uasin-Gishu 9, Kajiado 4, Migori 3, Kericho 2, Machakos 2, Nandi 2, Trans Nzoia 2, Siaya 1, Taita Taveta 1, Kwale 1, Kisumu 1, Makueni, Meru and Vihiga all having 1 case. The cases are distributed in various sub-counties across all these different counties, and I'll give a highlight of some of these. In Nairobi, again, as mentioned in the past, we have Westlands leading with 34 cases, Lang'ata 28, Dagoretti North 17, Makadara 16, Kibra 11, Embakasi East 10, Kasarani 9, Embakasi South 8, Kamkunji 8, Starehe 6, Embakasi West 5, Dagoretti South 5, Embakasi Central 4, Roysambu 4, Mathare 3, Ruaraka 2, Embakasi North 1. In Mombasa, Mvita leads with 14 cases, whereas Nyali has 6, and the least are in Changamwe having 2. In Nakuru, we have Nakuru East having 8, Naivasha 6. In Kiambu, we have Kiambu Town having 5, Kikuyu having 3, we have Thika having 1. In Uasin Gishu, the 9 cases are from Ainbekoi, 3 from Kapsaret, 2 from Keses. In terms of Kajiado, we have Kajiado North having 3, Kajiado East having 1. In Kericho, we have 2 cases from Ainamoi. In Machakos, the cases are from Athi River, 1 from Athi River Town, 1 from Machakos Town. In Nandi, we have 2 cases from Chesume. Trans Nzoia, 2 cases, all of them in Kwanza, whereas in Siaya, we have 1 case in Gem. In Taita Taveta, the case is in Voi, in Kwale, in Matuga, Kisumu, in Kisumu Central, and in Makueni, the case is in Kilome. In Meru, we have 1 case in Igembe South, and in Vihiga, we have the case in Vihiga Town. Today, we are happy to report that we've discharged 31 patients from various hospitals, bringing to total 1,936, the total number who've recovered so far, and we continue to salute our healthcare workers for this commendable work. Unfortunately, we've lost another 4 patients to the disease, bringing our total fatalities to 141, and our sincere and heartfelt condolences go to the family and friends of the departed. On a related matter, we have noted with a lot of concern, incidences of COVID-19 infections have arisen, and particularly due to cross-infection in healthcare facilities. And this is a matter that the ministry has taken seriously, and we would want to appeal to all hospitals, public and private, to be extremely careful to ensure that they put in place measures that reduce the possibility of cross-infection. The ministry reminds each and every partner that we shall continue to work together to ensure that regulations are adhered to when it comes to preventing cross-infection at the hospital level. And in conclusion, we would like to again appreciate our healthcare workers for their COVID-19 participation and response in the country, and we continue to prioritize their protection and to support them. We thank you all for your support, and we do remind you to continue adhering to all containment measures. Asanteni. Questions?
Thank you very much,
All right, thank you. My name is Gina Kirari from NTV. In regards to what you've mentioned about what you saw at Shalom Hospital, will we see this being done in other hospitals which may have reported cases of COVID-19 due to cross-infections, with seeing them actually being converted into quarantine facilities? Thank you.
My name is Graham Kajula from The Standard. My question is related to the issue of cross-infection you've mentioned. There was a time the DG said that they're preparing guidelines to make sure that every patient who steps in a hospital will be tested for COVID-19. What's the progress on that?
Thank you. I'm Purity Maseo, KBC. Recently, we've been reporting quite a high number of fatalities. Probably you can highlight on why we are receiving a huge number of fatalities. Does it have to do anything to do with now the virus is now being more of asymptomatic, and we are coming from the asymptomatic aspect of it in Kenya? Because you had said most of Kenyans or the patients are asymptomatic. And then in the last 1 week, most of the infections, we've been getting reports of 1-year-olds, infants. How is the transmission? How are the infants getting this virus? Is it through breastfeeding or the containment measures, or mother to child breastfeeding, or is it just the normal containment measures that are not being adhered to? And how do we protect these infants from the infection?
Fantastic. Thank you. Thank you for your questions. And let me start with Purity's question, particularly the last one. Indeed, we've reported an increased number of infants in terms of COVID-19 confirmations. And what we do know for certain is, one, regarding breastfeeding, through WHO guidelines, we continue to encourage mothers to continue breastfeeding. Breastfeeding has not been identified as a source of infection when it comes to COVID-19 from mother to child. However, what we are realizing is that some of these infants, when we do go to contact tracing and test the mother or the household, there are some positives that we are getting. So it's all back to those containment measures within our household. It's all back to ensuring that we are sanitizing our surfaces in the houses. For those who can stay at home and can work from home, that can be, undertaken. And for those who, live out of their households and go to the workplace, they're able to ensure that they are masked and that they're actually sanitizing. And so we'll continue watching this trend. So far, ideally, what we are noticing is primarily transmission from the household and the contacts of the infants. With regards to our symptomatic tallies, their symptomatic tally remains at around 78 to 80%. And so there's been no major change in terms of the burden within the country. What we are noticing, however, especially in the past 1 week, is most of our fatalities are actually fatalities associated with diabetes, particularly the condition diabetes. And so we are really calling on Kenyans to ensure each and every one of us who may have a comorbid condition, that you're ensuring that you're taking your medication and that you're living a healthy lifestyle, but also if you're at home or if you have a health condition and it's deteriorating or you have any symptoms that require you to come to hospital, that you seek care early enough. It's interesting to note in the past 1 week, ranging from ages of 40 to 78, most have actually been diabetics and hypertensives in terms of fatalities. And so it's still the issue of comorbid conditions. You have raised, Graham and Gina have raised two important questions on cross-infection when it comes to facilities. In particular, what we've seen in terms of Shalom Hospital. And yes, the DG has released guidelines in terms of how healthcare facilities can ensure that we're preventing cross-infection, all the way from the entrance of the hospital, a triage mechanism that ensures patients are triaged, those who may be presenting with symptoms of cough, any COVID-like symptoms with fever, they're actually filtered in one pathway and disaggregated from other patients. Indeed, what we are noticing is that in this particular case, there was cross-infection, and our teams are currently on the ground as we speak, teams from the Ministry of Health collaborating with county government teams to ensure that measures are put in place. And of course, as it stands right now, we have actually curtailed any further admissions to Shalom Hospital as we assess the situation, as tests are conducted for the current inpatients who are there. We have about 122 who are admitted there, and so there's a process ongoing, and Dr. Kuria will elaborate on what this approach will look like. And of course, this is a situation that will come about if all hospitals, whether public or private, do not put in place proper measures of IPC. And some of these measures include simple measures for the healthcare workers as they move from one patient to another, measures in terms of, the sanitation facilities for the patients, measures when it comes to the ventilation in the rooms, in the wards where the patients are, and of course also ensuring that there's that high index of suspicion by the healthcare worker as they deal with the patients. With regards to testing and our strategy when it comes to testing, Dr. Kuria will share more information, but it is important to know that it might not be that all patients walking into a health facility would be tested. Remember, when we've looked at the disease and tried to understand this new disease, it's a disease that, you could be tested today and that you're negative, but then tomorrow you happen to be positive. And so it calls for a very rational approach when it comes to rolling out a testing strategy. The other key issue, in terms of how we see this going forward is that the Medical Council, which is actually tasked with ensuring that health facilities are adhering to these measures, will scale up its efforts in terms of ensuring, one, there's that inspection to ensure facilities are actually adhering to these IPC measures, and two, to also determine what does it mean for your private facility to actually be able to handle a positive COVID case. What are the measures you should undertake as a private provider in terms of undertaking to ensure that you can actually, manage these COVID-19 cases? And so perhaps I'd ask Dr. Kuria to add in more information on this with regards to the testing strategy and how we see this going forward when it comes to IPC.
Thank you, Mr. Ngangi. The issue of Shalom and what has happened to Shalom, whether it's going to happen to every other health facility. Let me reiterate here that Shalom Hospital is not closed. Shalom is still operational. It still has 125 patients in there. In fact, there is one we are following up closely. And we are doing testing of the staff that are there just to know the extent of the disease within the facility. treatment is ongoing, but they are not taking in any other inpatients or outpatients until they establish what is happening. So it has not been converted into a quarantine facility, as you may have suggested. But for now, those who are in there are quarantined, just as the word quarantine means, until we establish that they have no infection. The healthcare workers who are there, we are trying to ensure that they are rotated because they cannot continue working. And we are working on a modality where fresh group of staff can go in with the proper fitting of PPE, and we have made sure that the adequate PPE has been availed at the hospital. So they will be rotated, and those who are in will be moved into safe quarantine, either at home based on the assessment of the home background that is being done currently, or in a facility, and we are in discussion with the hospital management to see how best we are going to quarantine the healthcare workers in that facility. So it will not happen to any other hospital that you get a case, then you close down the hospital. No, it will be on a case-by-case basis based on the level of the infection that is going to be identified. Moving forward then, it is important for the general public to note and that not every other hospital is a COVID facility. And the government in the coming week, through the Kenya Medical Practitioners and Dentists Council, is going to be gazetting the list of facilities that have been inspected and certified as fit for COVID management. So the public should be aware of this in the coming one day or two for the gazetted facilities for COVID-19 management. In the meantime, even though you are not a COVID facility, COVID-19 management facility, it's a requirement that every other health facility is equipped with adequate PPE for that unforeseen event that a COVID suspect may walk into your facility. You must have adequate PPE to be able to manage that suspect. And in the course of treatment also, you may encounter one who turns positive. Remember, we are still dealing with a huge percentage of asymptomatic individuals. So anyone may come in with malaria, but there is the chance of still turning positive is still high. So your hospitals must be prepared at all times. And you must assume that every other patient that you are handling is potentially COVID positive. And I think the CS has reiterated here again and again that looking around you, the person next to you could actually be positive. It's just asymptomatic. So healthcare facilities, whichever it is, a small clinic, the pharmacies, our IPC guidelines must be adhered to very strictly, and PPE must be availed to all. And even those who are opening small business premises, have a small kit of PPE around you, because anything may happen around you, and you may need to use that PPE. So healthcare facilities especially are required, therefore, to ensure they have an adequate stock of PPEs for those eventualities. On the issue of testing, yes, the ministry is in the process of realigning its testing strategy to manage so that testing is aligned to the measures that the government is taking. The current measures, of course, the government is taking, you are aware of the widespread transmission within the community. So the measures the government is geared to today is try and contain the infection as we are, and still mitigate those who may mitigate against the infection, so that we are able to isolate those who turn positive and manage them appropriately. But at the same time, keeping those who are not infected safe from the infection. So we are testing, therefore, is going to be aimed at aiding the government mitigate against the infection, and more so be able to contain the infection and flatten the curve. So as we align our testing strategy, whatever you alluded to, that every other patient walking into a facility needs to be tested, in the face of the current supply chain challenges that we are having, that may not necessarily be feasible. So we are going to align our strategy so that it helps the government mitigate against the infection, contain the infection, and at the same time be able to manage the supply chain challenges that we are currently facing. So this strategy should be out in the next few days, And you'll be able to get more about the contents of the strategy in due course. Thank you.
Thank you.